So as a doctor who cares for patients with diabetes, I often rely on my care team, and there can be different members of the care team. For example, a primary care physician, often an endocrinologist, a diabetes educator who can have different backgrounds, a nurse, a social worker, a dietitian, and perhaps a community health worker. And often a pharmacist plays a really critical role as well. There are a number of things that the care team really does a lot better than I can do as a physician. One is they often can spend more time with the patient, and they can answer questions, they can review materials. They also can spend time with the patient exploring feelings around diabetes. You know, it's something that a lot of people find frightening or disappointing or upsetting, and sometimes those negative feelings can get in the way with the person really taking care of themselves well. And oftentimes it's the support of the care team and that relationship that really helps that person to change and to do the right things to better care for themselves. So I think it's important for a patient to know before they meet a member of the care team what to expect. What is it that this person might be able to offer them? So for example, before I have my patient meet with the diabetes educator, I let that individual know, well, here's the kinds of things that this person can cover with you, here's some questions that you might ask, and here's how they fit into your team. They need to understand that that person has a particular skill set or knowledge base that might be helpful, and it goes beyond what I can do as the physician. For example, if I'm referring to a pharmacist, that might be about medication dosages or how to best use medication, but that probably isn't the right person to ask about food choices or diabetic foot care. So the patient does much better if they know what services and what kinds of special expertise that individual might bring to their team. So someone who I'm seeing back for routine diabetes care, I'm always checking their feet routinely, making sure their blood sugars are under control. Blood pressure control is very important for diabetics. We take a lot of interest in their cholesterol. Sometimes people need cholesterol medication. We want to make sure that's okay. And we're always screening for complications, including checking circulation or the person's ability to feel in their feet. We refer them for an eye exam. Typically it's once a year to make sure they don't have complications there. And then we're also looking for things like, has the person had any other complications which can affect many parts of the body? For example, the heart, the stomach or intestines. A person with diabetes would be at higher risk for a stroke. So these are the sorts of things that we're always checking for when we see back our diabetic patients.
And your cholesterol, there are two different parts.
I've had quite a number of people after their diagnosis come back after they've really started caring for themselves, eating better, exercising, quitting smoking, these sorts of behaviors, and saying, boy, the diabetes really got me to change in a way I really needed to. And it was maybe one of the best things that happened to me, because now I feel like I'm much healthier because I'm caring for myself much better.